panelists today will include Professor Oyewole Tomori. He is the chairman of the Ministerial Expert Advisory Committee on COVID-19, a member of the board of Gavi Alliance, a recipient of the Nigerian National Order of Merit, and was a past president of the Nigerian Academy of Science, and also a former vice chancellor of Redeemers University. Professor Obinna Onwujikwe is the director of the Nigerian National Center for Health Observatory Platform on Health Service Systems. He is the coordinator of the Health Policy Research Group and director of research at University of Nigeria, Nsukka. He is also the editor of the African Journal on Health Economics. Professor Martin McKee is professor of European Public Health at the London School of Hygiene and Tropical Medicine and research director in the European Observatory on Health Systems and Policies. He has written extensively on governance and health systems. Esther Agbon is the senior health financing advisor at Option, Evidence for Action project based in Nigeria. She works with government officials and civil society to simplify budget information and mobilize domestic resources for maternal and newborn health. Dr. Mukhtar A. Gadanya, MFR, is the head associate professor and consultant public health physician at the Department of Community Medicine, Bayero University, and the Aminu Kano Teaching Hospital in Kano, Nigeria. He is a recipient of the Presidential National Honor or member of the Honor of the Federal Republic of Nigeria for national service to the health and social sector. And he is a passionate advocate for health systems reform and strengthening. Dina Balabanova, PhD, is Associate Professor in Health Systems Policy at the London School of Hygiene and Tropical Medicine, specializing in health systems strengthening and governance. She leads a research portfolio on anti-corruption, including the Accountability in Action project. And finally, but not the least, we have Barrister Eze Onyekwe. He is a lawyer by training. Over the last 32 years, he has worked in the fields of economic and social rights, anti-corruption reforms, and public finance management reforms involving fiscal, legal issues, and economic governance. He works on economic and social rights, including the rights to education, health, housing, and adequate standard of living. He has led debates on the constitution reform process on the minimum core obligation of the state in economic and social rights, fiscal challenges in the federal system, and the amendment of the fiscal provisions of the 1999 Constitution. He has also litigated several freedom of information and recovery of root funds cases in courts. Next slide. Corruption is a public health problem affecting each component of the health system. It undermines Nigerians' effort and progress to achieving universal health coverage, as it prevents people's ability to access quality services and that they are entitled to at a price that can be afforded. So for the purpose of this meeting, the objectives are to discuss how COVID-19 is affecting health sector corruption and accountability in Nigeria, and also identify opportunities for tracking corruption and improve accountability. We would like to keep this meeting very interactive, so we encourage you to ask questions in the chat box, which we'll go through at the end of the meeting. We will also be sharing with you 2 digital polls during the panel discussion to get insights from our audience. If you have ideas based on this webinar, need more information, or would like to collaborate with the Accountability in Action Research, please contact Professor Obinna. His email will be listed here on the slide, and we will show the slide again at the end of the webinar. I am now handing over to Professor Obinna to tell us more about how COVID-19 has affected health sector corruption. Mr. Obinna, Professor Obinna.
Yeah, thank you very much, Siaku. Well, mine is to introduce the topic and the experts who deal with it. So I welcome everybody to the seminar. So my talk is an introductory one. It's simply titled, "What Shall We Do About Corruption in the Health Sector?" Looking at the common types and causes of health sector corruption in Nigeria. Next slide, please. So, I mean, it's suing the health ministry and the disease control agency over failure to account for COVID-19 money. In another country, well, in West Africa, the federal government is probing the state agencies over diversion of COVID-19 funds. And in Madagascar, we all know, we heard about a minister sacked, health minister sacked, because he wanted to misappropriate $2 million to buy sweets for the bitter COVID organic. So these are things that all point out to corruption. So, and then next slide, please. We know it is impossible to build strong health systems if we have the current weak accountability systems. If there's pervasive corruption, remains in the health sector, and then nobody is, forced to tackle such corrupt practices, and then it's funny or it's strange that governments and development partners they're always happy to keep pouring money down the current systems of weak accountability and endemic corruption. They know these things are there, but they are just delighted, if I may use it this way, to keep pouring money into such systems that do not generate a commensurate output for the funding. So the concept of corruption, corruption is simply when somebody misuses entrusted power for private gain. That is corruption. So it's widespread in the health sector in Nigeria, and it has negative effects. And I think it's high time we need to understand its systemic nature. And what's the effect of COVID-19 in enhancing corruption within the health sector, and then in the ways in which informal institutions and even formal institutions these days drive corrupt practice. I mean, we're hearing a lot about NDDC and all that, all in the news. They're all even formal institutions, but they're also informal ones that are also helping to drive corruption. So, I mean, we did a literature review to find what are the 5 types of corruption in the health sector. And then the ones we identified were, next slide, please. Absenteeism. Next slide. So absenteeism, I mean, when we say absenteeism, it's corruption. People don't they jump back, but it's a very prevalent corrupt practice within the health sector. Diversion of patients from public to private sectors, inappropriate prescribing, then informal payments and bribery. Well, these ones is what people usually call corruption, but there are other, as you can see, there are other corrupt practices. And actual stealing, people steal drugs and other supplies. So these are the 5 common from types of corruption from literature. But then we also next slide, please, interviewed health workers, to find the most common types that they will report at within the sector. Absenteeism was also reported as a common type of corruption. Then procurement-related corruption. This one is, everybody understands this one. Under the table payment, under the counter payment, health finance-related corruption. We hear a lot about this. And then employment-related corruption. Where people are being employed without being qualified, without going for interviews, they get employed, and the people who are even qualified do not get employed. So it's a pervasive of corruption. Now, what drives corruption in the health sector? Well, we may also argue that it drives it in other sectors. That within the sector, people just want to make more money, they want to be like Dangote, just enjoy life. But the absence of enforcement of rules and regulations to check corruption, we don't have that. People do whatever they want to do and they get free, and it's a problem. And then private practice by people employed in the public sector, they now devote the time they should use in the public sector in the private practice. So for private gain, there are cultural factors. People want to keep up with the status, some location, then political and social networks. We all can, with all the drama going on right now in Nigeria, we all can identify with the political and social networks driving corruption. And of course, if you don't pay people salaries, they may want to steal money or do other kind of things. So now, the effects of corruption, I mean, next slide, please. Next slide, please. So the effects of corruption, well, you can say corruption is in all sectors, but why it's very bad in health sector, because it costs lives. People die. I mean, if you can be corrupt in other sectors and nobody dies, but corruption in the health sector leads to loss of lives, leads to a lot of disability, and loss of many resources. And then because of corruption, we are not, health system cannot be resilient. And then, when we have pandemic, we struggle a lot because the system has been weakened. Things that should have been done were not done. And of course, with corruption, we should forget about achieving universal health coverage and other SDG targets. Nigeria did not achieve any health-related MDG targets. I'm sure it was because of corruption. I'm sure we're also at risk of not achieving any SDG health target because of corruption. So how do we mitigate corruption? Next slide, please, in the health sector.
Dr. Prof, you have 2 minutes left.
Yes, I'll soon be done. We mitigate corruption. We need effective sanctions for corrupt behavior. It's quite important. Until we have people pay for being corrupt, then we'll never get there. I think community monitoring for accountability is important. How do we involve community stakeholders at that level to help to monitor corrupt practices and ensure accountability? And then I think ICT can also help. So in conclusion, I think it's impossible to build a Nigerian health system, a strong one, if there is pervasive corruption and low accountability as we have. So we're only joking if we think we're going to have any strong health system at the level of with the current level of corruption within the health sector. It's impossible. We didn't achieve MDGs. We're not likely to achieve SDGs until we get rid of corruption. But preventing corruption is a complex and difficult task within the health sector. So we need to develop a truly effective system of auditing and accountability that not only exposes corruption like we have in Nigeria, but acts on such revolution. So don't just tell us NDDC is told 80 billion. What are we doing about it? So not the exposure, but to act. So this requires a system, needs to be explicit and transparent. And anti-corruption laws and regulations need to be enforced. A great deal can be done to reduce corruption, but it can't be done alone. We know that it needs a lot of stakeholders within the health system and others outside the health system. And international cooperation is also necessary. At least international to stop pumping money into corrupt systems. So this is a kind of brief introduction. Other panelists will now deal more with the issue, especially as it concerns COVID-19. Thank you very much.
All right, thank you, Professor Obinna, for that insight into the introductory part of corruption in the health sector. You did talk about employment, the payment system, out of small political associations, and how corruption in the health sector causes loss of life, leaving things undone, and may not allow us to achieve the SDG, even though we have not achieved the MDGs. Well, preventing, you say, is a complex thing. Well, but also felt establishing accounting mechanisms that is explicit and transparent can help. Now we'll move on to looking at the questions we have. We have 4 questions, and we have 5 panelists to look in any of these questions and address one of them of which they have interest in. One is COVID-19 affect health sector corruption and accountability in Nigeria? Any one of the panelists can take that. We also have, how have issues of accountability and corruption constrained or hampered the response by the public and private sectors to fight against COVID-19 in Nigeria? Question number 3 for any of the panelists is, how has corruption influenced the ability of people to access quality services during this pandemic, COVID-19? And of course, moments of crisis sometimes bring about opportunity. So what do you see as opportunities that we should harness during this time as solutions to tackle corruption and improve accountability in the Nigerian health sector? Mukhtar, if you're comfortable, I think you can just start with any of the questions.
I think the original arrangement is for Professor Tomori to go first, but I'm happy to talk at this juncture. And I want to talk on number 3. How has corruption influenced the ability of people to access quality services during this pandemic? And 2 keywords there actually are access and quality. We know access is beyond the services being available. Access stands on a quadruped, 4 elements: financial access, geographic access, cultural and structural access. Financial, people should be able to afford the services. We know what COVID has done in terms of making services more expensive by healthcare workers needing PPEs and the patients too and the clients coming to access services needing PPEs. And beyond the financial, geographic, a lot of facilities closed for their non-readiness to provide services during COVID. And then going to cultural access, even in Africa, it was Africa-wide. COVID organic was actually reversal to what people may consider as cultural ways to provide traditional care. So COVID actually has a way of, when the scientific community is not sure, is trying to find its footing, then people tend to vacillate between the traditional and the orthodox care. And we know what is in the traditional care is not as firm as what is evidence-based from the orthodox care. Structural issues relate to how the health services are being structured and are able to continue to provide care during COVID. We know the massive disruption. For example, nationwide, close to 20 to 30% of all care system was disrupted. And then going beyond access to the issue of quality of care, and quality essentially 2 broad categories: patient satisfaction, patients and client satisfaction is an important element of quality, and then the domain of adherence to technical requirement and technical prescription for the care. And so when we're talking about satisfaction as an evidence of quality, COVID has made it that patients and clients are less likely to be satisfied with the financial aspect of their care in terms of the money they have to spend to commute, in terms of the extra expenses they may incur to buy PPEs, either for themselves or for their healthcare givers. And not only financial access, part of satisfaction, the domain of interpersonal relation, how the healthcare workers may be overstretched, not being able to do all the proper interpersonal communication, with a lot of healthcare workers either sick or in isolation, has potential to increase the waiting time, leading to lower satisfaction for patients and clients. For example, clients are coming to access family planning services, and they are likely to resort to non-orthodox or non-formal care. And
Doctor, you have 1 minute left.
Thank you, Isiaku, and I'm rounding up. So in summary, corruption, as Professor Ovina Onyejukwe said, is pervasive, not only in our context, but then the COVID pandemic comes to exacerbate corruption in terms of negatively impacting on access, geographic, financial, cultural, and structural access, and then impacting negatively on quality with 2 domains, domain of technical content and domain of
thank you.
Patient satisfaction.
Thank you, Dr. Gadanya. Dr. Gadanya answer was responding to question number 3. How has corruption influenced the ability of people to access quality services during this pandemic? and he looked at the two keywords there, access and quality. So basically he talked about financial access, geographical access, natural access, interpersonal, cultural, and structural. Now, Professor Oyewole, are you there? Is Professor Tomori with us?
I think I'm muted. Yes, I am.
Fine. Can you speak to question number 1? Is COVID-19 affecting health sector corruption and accountability in Nigeria?
You're not giving me the choice to choose what I like to speak on, but that's okay.
All right, you have a choice. Now, seeing that you are a member of the Ministerial Expert Advisory Committee on COVID-19, I was thinking
yes,
I could just help you by choosing a lighter one for you that speaks to your work.
No, I've actually had my mind on moments of crisis, and I think that's
okay. Let's do that. Let's do that quickly.
That's why I wanted to talk about that. You know,
okay. Let's speak to number 4.
Yeah. Thank you very much. I think COVID-19 has exposed what we know, has brought out the rot in our system, which you already know. But this time, COVID-19 has brought out the stench in our system. And we are a nation that lives by lessons forgotten, not lessons learned. We have had enough experiences with so many diseases that by now we should be experts at taking care of diseases, and we can name them from time immemorial. But as Benjamin said, you know, where corruption comes in, it covers your face and makes you not even realize the things that are, but we have taken certain things for granted and are taking it as normal. Incidentally, just before I came in here, I was looking at the history of corruption in Nigeria and saw a document, a colonial office document in 1947, in which they actually carried out an investigation into a local government in Igbo and found that the issue of corruption came in. And then way back, you can go back 1947, 1952, 1956, 1962. These are corruption proven by people that we respect. I mean, real top people that we call heroes in Nigeria now. Today, they were all charged with corruption. And when it became a possible thing for us to do something about them, you know, we voted them back in and supported them. And that's where the portion of this, I think this is the time for us to look back on the past, look at the crisis of what has occurred to us. How did we get here? What have we as individuals, as a community, participated in ensuring that we perpetuate corruption? When a man from my city, my town, steals money, it's okay. You know, this type of things. So we reach a level where we need to come out and say, look, this is affecting each and every one of us, irrespective of where I come from. And as I mentioned, we are a country or a group of people that live by lessons forgotten. As soon as one crisis is over and the problem is over, we forgot it and look and see over there. This was a country that was praised for doing Ebola well. But soon after Ebola, Lassa fever came, yellow fever came, and do other things. So the time of crisis like this is enough for us to look back and see what are the things that we've done right. There's quite a lot of things we've done right. What are the things we've done wrong? How can we look at those? What are the factors that made us do those things right? Can we get back to them? The time of this crisis are not there for us to sit back and look at the situation and say, look, this was a country that was able to do this. We had great people who did so many good things in this country before. How did they do it? Why did they do it? These are the things we should be examining now at this time of crisis and say, look, now, we may not be able to answer the question for COVID-19, but another epidemic is going to come. Are we going to be ready for the next one? Now is the time to sit back, take advantage of what is on now, and then look forward and say, look, this must not occur to us again. Never again, as I don't know who said it, never again. You know, who said it's time for us to do that and say yes, and examine ourselves. It boils down to you and me and every individual. The role that I play in this corruption business becomes most important thing. And one of the things that came out in that colonial thing was that it was like we enjoy the fruits of corruption. We swim in the sunshine of corruption. I think time has come for us as individuals to look back. We have the role. It is the important role that you and I have to play that is important. And again, that finally on COVID-19, we always blame our government. Oh, the government has not done this. The government has not done. Of course, the government has a problem by not even they're giving the impression that it is the one that is controlling the epidemic. It is not the government. It is the individual, because the individual that dies of COVID, it is not the government that dies of COVID. The most important person in COVID-19 control is the individual. And so there are guidelines for you to prevent it from yourself, because if you get it, you die. The government, one or two of them may get it and die, but the government continues. So you are the most important person. I think this is a message we need to pass out to our people, that in this COVID control, the individual person is more important than even the government, more important than even.
Prof,
I want to end up on that note. Thank you.
Yes, you can still round up with just 1 minute. Just take 1 minute to round up.
Okay, just to say, the message for me is that this is an opportunity. This crisis is an opportunity for us to look back, to have a rethinking about the things we've done in the past. I mean, corruption has been from time memorial. So let us move forward and do what is right. Over.
Thank you, Prof. Prof spoke to question number 4, moments of crisis sometimes bring about opportunity. So in looking at the opportunity, he says it has exposed a lot of lapses in our health sector and our lives in general. He took us through the perspective of corruption in Nigeria, dating back 1947, how our heroes have failed us and how we have celebrated them. Well, you heard the last message he has for all of us, but more importantly, the note here is what we should be doing by answering some positive questions that can help us salvage the situation, looking into how corruption has eaten deep into the fabrics of every system in this country. Now, the other questions, 1 and 2 are open. We still have Professor Martin Maki. Are you there, Prof?
Yes, I am. Good afternoon. Can you hear me?
Yeah, I can hear you very well. You're welcome to the webinar meeting.
Thank you very much. And I wonder if someone could move to the slide that says European Union procurement law. It should be in the slide deck. Okay,
you want the questions to be on the slide?
Yeah, well, I will be referring really to questions 2 and 3, but many of you will be wondering why a professor from Europe is talking in a webinar about corruption in Nigeria. And I'm not actually going to talk about corruption in Nigeria. I'm going to be talking about corruption in other countries, because I want it to be clear that Nigeria is not uniquely corrupt. This is a problem that many countries are having at the minute. And I want to make the point.
You have 5 minutes to do that. Your time starts now.
Okay, I want to make the point that the current pandemic is an opportunity that many people are making use of for corrupt activities. And I'm going to talk around procurement. So in law, formally, in the European Union, we have a very clear set of procedures for procurement. In an emergency, and those take place normally, tenders have to be published, proposals need to be put forward. There are all sorts of mechanisms where there's a limited number of potential providers, but there's a strong principle of transparency and accountability. However, there is a recognition that in an emergency, purchasers can set aside some of those procedures. And this is an example of when they do that. So there's scope to reduce the deadlines, which should allow people enough time to prepare a bid, to have negotiations without publishing tender documents, make a direct award to pre-selected providers, and so on. But these should only be used in an emergency insofar as it is strictly necessary for reasons of extreme urgency to do so. They should not be used routinely, and when they are used, there should be lots of safeguards. So the next slide, please. Some of you will be familiar with this Graham Greene book. It was made into a film, and it is about post-war Vienna, and it describes a character, Harry Lime, who was making money out of producing substandard penicillin, which was leaving children dying or seriously disabled. So that was a time of crisis, and Harry Lime was someone who was exploiting the crisis. Emergencies have always provided many opportunities for criminal activity. Lots of money is being spent in a hurry. There's a lot of pressure to deliver results and overcome checks and balances, and the regulators take their eyes off the ball. Next slide, please. There have been so many examples of this in Europe. A criminal investigation instigated after an order for face masks in Belgium. It was found to be with a provider in Luxembourg. The order was delivered late, the products were substandard, and it was found that the company had only ever filed accounts once, reporting a cash balance of a few €100. An investigation in Denmark found that 200 million Danish kroner order was unsafe. There was widespread forgery of certificates and abuses by some of the authorized testing facilities that are meant to check on these things. Criminality in Sicily and Italy, whenever someone involved in procuring the personal protective equipment was diverting the money into his own private account. And another example where a French pharmaceutical company was defrauded of €6.4 million in a purchase of face masks from someone who would never delivered them. So these are not unique to Nigeria, they're not unique to Africa. Next slide, please. The United Kingdom, my Prime Minister, Boris Johnson, boasts, like Donald Trump, that the UK has a world-beating response to the coronavirus. And it is certainly true that when we look at procurement failures, the United Kingdom is up there among the leaders. We are doing exceptionally well in failing to procure things in a way that works. An accountancy firm was ordered a contract to develop, to source personal protective equipment. The service was described as useless, and the manufacturers had to find ways to get round it. A British minister was responsible for overseeing a contract with a Turkish supplier of T-shirts for 400,000 items of personal protective equipment, and he made much of the fact that the Royal Air Force was flying out to get it. The order was delayed, and when it came, only 10% of the order was fulfilled, and none of the items met the required standard. The United Kingdom government was offered 2 million coronavirus antibody tests by Chinese companies for €18 million. The money was paid in advance. The Prime Minister said this was wonderful, it would be a game changer, simple as a pregnancy test, but when they arrived, they didn't work. Next slide, please. We had a ventilator challenge. We were running short of, we were worried that we would run short of ventilators.
Prof. McKee, I'm sorry, you have 2 more minutes, so can you
I will be finished. This is my almost last slide. And the government was confronted with the need to get ventilators. It issued a challenge. A lot of companies came in offering ventilators, but they'd never made them before. They had no idea how to make them or how to get regulatory approval. One of the companies which offered to do so was Dyson, which is better known for making vacuum cleaners. Experts had said this would not work. They'd written to the government and said, this is not, these people are making ventilators that are not meeting the appropriate standard. And then an initial draft of the specification was simply lifted from YouTube, describing a ventilator from the 1960s. Next slide, please. We will have a future inquiry into the UK's coronavirus response, but this raises very fundamental questions that apply to everybody. How do we balance the speed of procurement and prevention with prevention of corruption and criminality? How do we do much, much better in professionalizing procurement? This is a highly skilled task. And finally, in the United Kingdom and in some other European countries, how did things go so badly wrong? Thank you very much.
Thank you, Professor Martin McKee. You have left us with a lot of questions to grapple with, and I hope the professors here and experts here will do justice to the questions that you have concluded your presentation with. None of the ladies have spoken, so the ladies in the house, we have Dr. Dila Balabanova, we have Mr. Abon. Can any one of you take any of the questions and speak to it? Hello.
Hi. Thank you, Isaku.
Okay, Esther, you're welcome. You have 5 minutes to do this.
Yeah, I want to look at questions 2 and drive into question 4. And looking at corruption in the lens of transparency and accountability. Transparency and accountability, of course, like all speakers have said, is not new in Nigeria. We have been battling the endemic issue of opacity within the health sector and in governance in general. And so with COVID-19, the life-threatening circumstance that we face, you think that things will change, but of course it never changes. And so you find out that the promises the government made, especially in terms of managing COVID-19 funds prudently, has not come to bear. We have a COVID-19 framework for the management of funds from COVID-19. And that framework is out there on the Office of the Accountant General's portal, the Open Treasury portal. We have been asked that every citizens can access those portal and get information as they come in, or records. Now, MDAs participating in COVID-19 intervention are expected to publish their reports daily. They publish inflows, outflows monthly, and then also publish expenditure reports. The Office of the Accountant General also has a responsibility to ensure that daily inflows and outflows and also procurement information is published. But you and I, you can go to those websites. Right now, if you go to the Ministry of Health's website, you will find no information. I mean, the last information around the budget is from 2016 budget. Now you go to the humanitarian ministry, there's really nothing about COVID-19 expenses. And the originating agencies is the Ministry of Finance and the Office of the Accountant General that host the Open Treasury portal. You go there and you find, the only information you find is the receipts or donations made in April ending, which is just about 12 billion. But today we hear about CBN giving out over 20-something billion naira for 20 projects. Which projects are those? And so for me, I think that transparency and accountability is a key opportunity for civil society to get involved. But the management of the COVID-19 funds has greatly brought public distrust of the system. Public distrust in the sense that people do not even trust the treatments they are getting from the facilities or from the medical personnel. They just
Doctor, you have 2 more minutes. 2 more minutes to go.
Yeah, they're taking the number. So I think that there's a large opportunity, there's a huge opportunity for us to get it right. Can the government publish what it takes to treat an asymptomatic, maybe the different categories up to a very severely symptomatic patient? What does it cost to treat them? How can we plan for the short term, for the medium term, and the long term? This is the time to get it right. The question, million-dollar question here is, when civil society gets involved and raise issues around procurement or transparency and accountability, who will bail the cat? Who will take, which institutions are ready? Because they have those, they have the sanctions written into the guidelines, but who wants to bail the cat? Who wants to say, yes, you are going to go in for those infractions that you have made? So that is the question. Civil society will always raise the issues, but then let the government also do its own part by ensuring that those agencies publish these reports timely, and then civil society can get involved, analyze those reports, and then use it to support or help the system. Thank you.
Thank you very much. That's Dr. Esther Agbon, civil society
Mrs.
organization.
Esther Agbon, please.
Okay, Mrs. Esther Agbon. Civil society should get involved. We talked about transparency and accountability. Well, she said things have not changed or have refused to change. And for the pandemic, the management of COVID-19 fund is not adequately accounted for. Talking about publications, there are no publications of how these funds have been managed. We still have Dina in the house. She has not spoken. Maybe she would take this time to speak on to the last question that we have, or any question of her choice. Dr. Dina, are you there?
I'm here. My hope was to conclude, to be the last one to speak. We have so many participants who haven't had the chance to respond to other questions. So
fortunately, you can conclude now. Okay, hold on. Let's have Barrister Eze. If Barrister Eze in. Hello, Barrister.
Can you hear me?
Yeah, we can hear you now. Can you speak to any of the questions?
Yes, I would like to look at the opportunities arising against the background of what we had before the COVID-19.
All right, you have 3 minutes to do that.
Just 3?
3.
Okay.
Time is gone.
I am looking at the situation in the health sector before COVID-19. Just to recall that before COVID-19, the Ministry of Health had its procurement function taken away by the Bureau of Public Procurement and handed over to the Ministry of Agriculture for various infractions of the Public Procurement Act. And after a lot of warnings and they persisted, their procurement function was taken away to the Ministry of Agriculture, and it was only restored during COVID-19 to give you the background of the capacity of the Ministry of Health to procure for COVID-19. Secondly, if you look at the 2017 audit report of the Auditor General for the Federation, it recorded 8.36 billion naira infractions for the National Health Insurance Fund, which was supposed to be the catalyst for universal health coverage and reducing the out-of-pocket expenditure of Nigerians in the health system. Now, this is the background to where we were before COVID came on board. And with COVID coming on board, and we had Bureau of Public Procurement emergency procurement guidelines, which shortened the time for procurements, reduced the need to advertise, and all those things that will make it easier for people to follow and ensure that procurement is properly done. And this is the regulations that is being used. And then when you track back a little, you also ask yourself whether failures in governance in terms of what the ministry should have done or the minister should have done had not facilitated where we are today. For instance, under the National Health Act, we should have had each health agency, each health institution in Nigeria apply for and being issued with a certificate of standards before they could continue operating in Nigeria, 24 months after the coming into force of the National Health Act. Whether that neglect of duty by the Ministry of Health or by anybody whatsoever who was supposed to do it amounts to corruption is another thing altogether we can debate. And also the minister was supposed to give us an annual state of health report, and which they have consistently failed to do every time.
Barrister, you have 1 more minute.
Good. So
and please, we have pop-ups for pools here. You can just click on any and submit. Continue, Barrister.
All right, so if we have had our institutions, health institutions properly certificated before the pandemic, we could have been in a better position to deal with this pandemic. And if we are learning any lessons, it should be more focused on preventive measures for corruption rather than addressing it from the poverty of remedial justice. Somebody has already mismanaged resources, a life has already been lost, and we are crying after it. There's no way we can return a life once it is lost. So let's focus more on preventive measures rather than after the fact measures. Thank you.
Oh, thank you very much, Barrister. So, Barrister is suggesting we concentrate more on the preventive measures rather than the punitive measures. Well, the pools popping up the screen, so you can just click on any of your choice and submit. And then we'll have a lot of questions also that the panelists, we would like the panelists to speak to. But before then, we would like Dr. Dina to give us a round-up. Hello, Dina.
Thank you very much. If I can have my slide, please.
Yeah, you are live.
If you can get my slide, I was just hoping. Yes. I'm just going to say we have been looking at various countries. We work on corruption in many settings, high-income countries, low-income countries, and we are along different projects. However, the evidence, somebody asked about evidence of what works and what measures have been taken to combat corruption are extremely weak. So this led us to start asking a slightly different questions, and this is the project with which this webinar is connected. Thinking about what is it about organizations and structures that enables corruption, motivates corruption? We know very little about sanctions of individuals. Many of you said we should do it, but there are very few countries that have managed to do it. And actually, when you have one person, then another person comes, and how do you prevent this? And this project is novel in a sense, looking at incentives, looking at organizational structures and systems, and trying to understand what is it about people abusing the system, but at the same time, survival corruption. The fact that people don't get paid, they have to, in many cases, break the rules. And in many cases, the rules are unclear. So I think our project is also trying to look at the social structures. We find in our work in Nigeria, Prof. Obina, that a lot of the health providers, for example, who are absent, they do that because they have to fulfill social obligations. So we need to understand the social preferences, the pressures, the values out there. And it was really interesting to hear Prof. Tomori talking about the history, because that's something that we need to understand. So
Dr. Dina,
finally,
you have 1 minute to round up. 1 minute to round up.
I just wanted to encourage you all, after this webinar, we'll continue to engage, and we're going to have series of activities and webinars that we really would like to try to think and test of possible solutions to these wicked problems. And as Martin said, we are looking at these issues across many countries, but Nigeria, there seem to be a lot of energy and interest. So I hope many of you will stay involved, and we can respond to many of your questions by email or via other platforms. Thank you very much.
All right. Thank you, Dr. Dina. So we have Professor Tomori, Professor Obidna, Professor Martin McKee, Esther Agman, Dr. Mukhtar, and Dina, all of which have spoken. And then we'll now like to go to our questions and see how the panelists can speak to any of the questions that has been put out there on the chat box. Federica? Hello?
Yes, yeah.
You are up. Come in, please.
For the polls, sorry.
Yeah, yes, our questions.
Yeah, just give me a second.
Okay, Michael?
Okay, good afternoon, everyone, once again.
Michael, can you hear us?
Am I the only one not hearing?
I think someone else should take the questions.
Yes, Michael. The questions these are the questions. These are the questions. One question says, what are the systemic reforms in place instead of looking at sanctions for corruption?
Okay, let me rephrase the game. It says, what are the systemic reforms that needs to be put in place to reduce corruption in the first instance, even before we go to sanctions? So more like, what are the ways of preventing corruption in the first place, instead of talking about sanctions? So that's question one. Question two says, what are the anticipated political economy obstacles to these reforms, and how can they be overcome, with examples of successes, both locally and internationally? So
I think we can just hold on to these two, but we still have a lot of questions on the chat box. Any of the panelists can speak to or respond to any of these two questions. Who is going to go up first? Can we have Professor Obidna?
Tomori.
Professor Tomori?
No, let Barrister Onyebere respond to that.
Okay, Barrister.
Okay, on the issue of preventive measures rather than fighting after the head is already off, I think that we need to introduce more issues around accountability and transparency. We had Esther talk about the portal, which has been underutilized. If the agencies are somehow compelled to disclose these expenditures on the portal, maybe Nigerians will have a lot to engage on. And also, if there are capacity issues in the Ministry of Health that led them to be suspended from doing procurements and agriculture was doing for them, it could also be possibly addressed by providing more training for them. So these are two key issues I think we can talk about before we talk about sanctions.
Okay, there is another question. There is another question.
Political economy obstacles.
The one that talks about political economy.
Obstacles.
Hello, Barrister.
Okay, I didn't quite get that question. The political economy of corruption?
Let me take it again.
Take it again, please.
Okay, so it says, what are the anticipated political economy obstacles to these reforms? So, and how can they be overcome? So yes, you want to do reforms, but what are the likely political economy obstacles or bottlenecks to those reforms happening? And then you have examples of any successes in this regard, both locally and internationally.
Of course, there are challenges going to arise that have been mentioned as we are talking about, that people are so poorly paid. Some
I think it's gone.
Okay, Federica. Federica, can you hear me?
Yes, Isiaku, tell me. What do you want
Okay, come in now.
How do you want me to support?
That's fine. We can ask another question from the panel, maybe from people in the room. One other question that was being asked is, how can we ensure transparency in use of resources for COVID-19 response in the public sector? So if anybody could maybe answer that question.
So I would just say, this is Esther speaking. How can we ensure transparency? There's so much we can do if we hold the government accountable by what they have said, what they have put out there by themselves. The framework for management of COVID-19 funds is a response to the promise by the president that the funds will be used prudently and that he's meeting the expectations of citizens. And so he has failed in doing that. So how do we call all of these agencies participating in COVID-19 response to do what they have said they will do on that guideline? The guideline is clearly on that portal, and it is, I will call it a golden rule, sort of, that if each one of these organizations should follow, then everything will be out there transparently. And then we can see how much is going into what. 20 projects that has consumed over 26 billion naira. Where are those projects? Can you just name them? Who are the beneficiaries? That's all citizens are asking. And that would enable, it will build in a bit of trust for the system and for governance. If that is not done, then I don't know how else we can do, be transparent.
Okay, Prof. Tomori, do you have anything to add to this? Prof?
Yeah, thank you. I just want to say that we seem to forget the very foundation of corruption is the individual. It's what I do, it's what you do, what you do to other people that leads to corruption. And it wasn't like this because we started from home. The training, the prevention started from the home, not from the office, not from the university. Each family was told, I grew up knowing that if anybody does something, the entire village ostracizes that person for doing what is wrong. But today, the wrong one is the one that gets on NTA, and that's the one we see. And that's until we begin to address that individual foundational problem of what it is. It is not whether it's my brother that did it, but what has he done? Is it right? Is it wrong? And that's the thing. And until we begin to address that, the greatest beginning of our prevention of corruption in this country.
Thank you, Prof. Michael, do we have another question?
You have the role. Thank you.
Okay. So I think we've been talking about the very global picture all day long. So I don't know if any of the panelists can talk to us about any successes, what has worked in different climes in curbing corruption in the health sector. Any of the panelists, please.
I don't know, this is Mukhtar. I found what Professor Tomori said on two fronts very important. The issue of our history, what happened to our heroes in court, regarding how we not only brought them back in the elections, we, in addition, canonized them. Quite insightful. I know in Nigeria, only people like Professor Tomori can talk about that, and has been baffling actually to younger people like me as to how, as a country, we ended up doing that. And two, Professor Tomori talked about individual models, and which in a recent anti-corruption course I attended, the issue of islands of integrity. And as bleak as we want to describe issues in Nigeria, we have lots and lots of islands of integrity, people we can learn from, and we are honored to have some of them on this forum. So I think an important issue, those islands, to identify the people in spite of the glaring rods are still able to do what is right and are still able to thrive winning national recognitions, being recognized locally and internationally. So I feel this is an important way to go forward in Nigeria, not looking at it totally in the negative, but looking at what the islands of integrity have done so well to get results for them, for themselves and for the country.
Thank you, Gadanya, Dr. Gadanya. Federica, can you share your polls?
The polls are, yeah, the polls are up and conducted, and the when looking at the forms of corruption that have increased most as a result of COVID-19, the public feels that the weak accountability of government expenditures, 61% says that actually that has been increased most as a result of COVID-19. And secondly, the lack of transparency of resource allocation decision, which received 31% of the voters. So I'm not sure if any of the panelists would maybe react to that, the fact that the public thinks that of all the forms of corruption, the one that increased most as a result of COVID-19 is the weak accountability of government expenditures.
Yeah, so
thank you, Federica. Can we have any person from the attendees to say one or two things? Our approaching roundup time. Anybody from the attendees, just say something.
Yeah, can I say something?
Yeah, can you just introduce yourself and go ahead?
My name is Umar Sali Anka from Kano, Nigeria. Hello?
We can hear you.
Okay, I think the issue of accountability in dispensing the cases of COVID-19 within the government cycle is maybe using the word security votes in some context that some money can be allocated without people having access to how they are being spent without limitation. So to me, general public.
Sally Anka is grappling with his network. But quickly, before I bring in Marlene, I would like to re-emphasize that insights from this discussion and questions from attendees will form the Accountability in Action Research project, which is being funded by the Health Systems Research Initiative and implemented by the London School of Health and Tropical Medicine in partnership with Option, the University of Nigeria, Bayero University, and the University of Malawi. The major objective, of course, we did say, it is just to discuss on a plain ground, no blaming anybody, nobody is responsible for anything. But we just want to talk to bring out these issues that is affecting health sector, talking about transparency and accountability and the corruption in Nigeria, especially in the health sectors, and to identify some opportunities for tackling corruption and to improve our accountability system. Hello, Marlene.
Yes, great. Thank you very much, Isiaku, Ahmed, and all our presenters and panelists for their participation in this webinar. I hope it gave everybody with good insight in the Accountability in Action project and how health sector corruption can be thought through accountability in Nigeria. Thank you very much, Isiaku Ahmed of Voices Against Corruption, for facilitating and hosting this webinar. Thanks also to Dr. Tomori, Barrister, Esther, Dina, and Martin, and Dr. Mukhtar for your fantastic facilitation and insights that you provided. And thanks to everybody for attending. If you have any thoughts or would like to collaborate with us more, please get in touch with Professor Obina. His email is on the screen, and in case you'd like to discuss this more, do reach out to him, and we will send all of you a recording of this webinar to everybody who has registered. If you haven't registered, just leave your email address in the chat box, and then we can reach out to you and send you a recording of this webinar so you can look at it after. But thanks everybody for your participation.
Thank you very much.
Thank you, Marlene.
Thank you. Thank you.
Thank you to everyone of us out there that has contributed or participated in this webinar. We look forward to seeing you in some other of our events. And like Marlene did promise, we're going to share the recordings with participants that have registered. And if you have not registered, kindly just drop your email on the chat box. Remember that all of this is being put together by the Accountability in Action project that is being supported by the London School of Health and Tropical Medicine in partnership with Options, the University of Nigeria, Bayero University, and the University of Malawi. I am Isiaku Ahmed. I'm a journalist and a broadcaster and social activist. I work in the area of anti-corruption. Thank you for being with us.
Thank you.
Thank you very much.
Thank you, everybody.
Thank you.
Thank you.
Do your part in the corruption show.
Thank you. Bye.
Bye-bye, everyone. Bye-bye, Prof.
Bye. Don't worry.
Don't worry. Bye-bye.
Yes, sir.
That person doesn't do it. That is cultural. The culture.
Which one is mine? This one?
I think that's